Okay, so after the 19th century was the 20th century. And during the 20th century, there was knowledge gained about the role of blood in the body and about blood types. They learned more about white blood cells and how they protect against disease. When you have an infection or sickness of some kind, your white blood cells multiply and increase to help fight off disease. There were new medicines developed in the 20th century, insulin to treat diabetes, antibiotics to help fight infections. Most of you have probably had that if you've had an ear infection or strep throat. Vaccines to prevent people from getting disease. Like I said earlier, you've all had to have vaccines if you were going to go to school. And new machines that were developed. Kidney dialysis machines for people with kidney diseases, heart-lung machines when people had open heart surgery, and CAT scans. CAT scans are like a souped-up x-ray machine. They can see more in depth inside the body. And then there were surgical techniques developed to cure conditions that were once fatal, so people can have organ transplants. Such as like heart or kidneys, have limbs reattached if they had an injury, that they lost an arm, lost a leg, that they can reattach these things. And then test tube babies. Sometimes females have a hard time getting pregnant, so they can take the egg out of a woman and a sperm out of a man, mix it in a little test tube, and then put it back in the woman for the baby to develop. And then they also, during the 20th century, implanted the first artificial heart. So this is some kind of heart that's made out of artificial materials. And then 20th century, insurance healthcare plans were developed, and we'll talk more in depth about this at the end of the unit. But you had Medicare and Medicaid that was developed by the federal government. And then hospice was organized. So people with terminal illnesses who didn't want to die in the hospital, they knew they only 6 months or a year to live, they could have hospice come into their home, nurses, doctors, periodically to check on them, give them medicine. But they didn't have to stay in the hospital. If they didn't want to stay there till they died, they could, die peacefully in their own home. So that is your 20th century.